feel free to use the chat box. Drop your question or comment in either English, French, Arabic, or Portuguese. So we'll do the effort to bring those questions to the attention of the speakers so that you have some responses. So for this webinar, I have 4 distinguished panelists. Let me call on them just briefly. We have Prof. Erin Torbelskon, who is a lecturer in the Department of Geography at the University of Western Cape in South Africa. He's also an honorary fellow in the Department of Geography at Durban University in England. We have Mr. Amadou Kanute, who is the founder and executive director of SICODEV, which is the Pan-African Institute for Citizenship, Consumers, and Development based in Dakar, Senegal. We have Ms. Florence Nakazi, who is a research fellow at the Economic Policy Research Center, EPRC, in Uganda. We also have Dr. Michael Samson, who is a research director at the EPRI, which is the Economic Policy Research Institute in South Africa. So those are our 4 panelists. We've shared actually their longer profile in the chat. They have quite extensive experience in researching, supporting, especially issues around social protection in Africa. Before I call on the panelists, I have the distinguished honor to welcome USG, Ms. Cristina Duarte, who is the Undersecretary General and Special Advisor to the UN Secretary General on Africa. Ms. Duarte is very passionate about these issues. I'm sure you will see by yourself. So please allow me to welcome Ms. Duarte. USG, are you with us?
Yes, I'm here.
Welcome, madam. The floor is yours. It's good to see you again.
It's always a pleasure, Barasu. So good morning from New York, Excellencies, ladies and gentlemen, dear colleagues. Welcome to this webinar on the future of social protection in Africa, organized by my office and the African Capacity Building Foundation. Allow me to take this opportunity and say that we are grateful to work with ACBF as our primary liaison to the wide array of innovative and research-oriented think tanks in the continent. And I'm pleased to greet Barasu Dioara from the ACBF, who will moderate this webinar. So today we'll hear from experts at 3 African-based think tanks, as well as a leading academic expert on social protection. The topic of today's webinar speaks to the heart of the vulnerability of external shocks that African countries are currently exposed to and limitations of methods to respond effectively. The COVID-19 and the triple finance food and energy crisis have underscored the need to adopt mechanisms that allow us to support the most marginalized in our communities, so we truly leave no one behind. We have reached the halfway point of the world to implement the SDGs goals. We are off track. When the SDGs were developed a few years ago, the achievement of no poverty was established as the first goal, SDG 1. And how to reach that goal? The implementation of nationally appropriate social protection systems and measures to all was given a place of high importance. Target 1.3. Allow me to repeat. Implementation of nationally appropriate social protection systems, demonstrating that ensuring universal social protection is a major piece of leaving no one behind. Allow me to highlight 3 key issues that speak of the relevance of social protection, and maybe using these 3 key issues to start a process of reconceptualizing social protection from a made in African standpoint. First, development management. Social protection is a development policy instrument, not an emergency response tool. This is a critical differentiation because for too long, African countries and development partners have focused in managing poverty in Africa instead of managing development. That is, adopting measures that address poverty as a result of the lack of development, but that do not address the root cause of poverty and underdevelopment. In my view, this has been a mistake. Social protection is a holistic policy solution. It includes short-term impact measures, I agree, such as cash transfer. In some situations, we have no alternative, but also medium and long-term development tools, such as pension mechanisms, health and employment coverage, and the list is long. As such, social protection contributes, yes, to reducing poverty, exclusion, and inequality, while enhancing political stability and social cohesion. Acknowledging the level of instability in Africa, social protection needs to start being addressed also as a peace and security tool, to help the state to be there where he has not been for decades. It is an essential policy tool to prevent and recover from economic crises, natural disasters, and conflicts because it creates resilience. And this is what is missing in today's Africa. Everybody's talking about accelerating the SDGs because you are off track, but you have not built resilience. The MDGs have not delivered a resilient continent. Putting Africa in a situation or in a starting point of implementing the SDGs in a disadvantageous, let's say, starting point. So social protection contributes to economic growth. And this is an important concept. It's not charity. Social protection contributes to economic growth by supporting household income and domestic consumption, aggregate demand. It also provides decent work opportunities and promotes skills development, so leading to improved labor market performance for participants, as well creating productive assets. Second, human capital development. Social protection programs include provision for healthcare, education, skill development, thus contributing to the long-term development of individuals and communities. They are a critical tool for activating one of Africa's main assets, the demographic dividend. With effective social protection systems, Africa's growing population can move from being a burden for overstretched public budgets to a powerful workforce. Third, traditional mechanisms. And this is where OSA's narrative around social protection has been focused. Africa is not starting. We need to understand that Africa is not an empty space from a social protection. It's not. On the opposite, Africa is not starting from ground zero when it comes to social protection. Indigenous grassroots social protection mechanisms founded on African traditional values and based on kinship or self-organized mutual aid predate colonization and have long acted as an important tool for welfare protection and social cohesion. As we speak, traditional social protection mechanisms have been much more efficient and effective to support communities against external shocks than formal schemes of social protection. So we must recognize that you are not building social protection programs in a vacuum. Indeed, we are likely to be more successful if we properly identify and build on the benefits of community-anchored traditional methods. Allow me, concluding, as final notes, I'd like to underscore 6 ideas. First, I feel that there is a need to change the policy-making mindset from backwards designed social policies to forward-looking human capital policies, so that we can move from assistance charity approach to a clear recognition that human capital policies should be designed to generate social, economic, and cultural returns. Second, this requires a new conceptual approach associated to a new narrative, so that we can support policymaking partners moving away, for an example, cash transfer policies towards food for assets policies. Third, while achieving development entails a reduction of poverty, decreasing poverty does not necessarily mean that a country has developed. And this is an important difference. Fourth, this new mindset would require for social protection policies be considered as important players in the macroeconomic dashboard. I would repeat, social protection policies are important players in the macroeconomic dashboard, which means uncontrolled tools for recovering from COVID-19. Fifth, social protection is the low-hanging fruit in this macroeconomic dashboard to recover better. If we look for low-hanging fruits to unlock the recovering better in Africa, social protection is one of them. The last one, for such, financing social protection in a sustainable way demands domestic resources. Social protection should not be financed by external financing, by ODA. It should be financed by domestic resources. We need previsibility, and external finance sometimes does not bring. It should be a strong item in the national budgets. The challenge is how to create fiscal space for that. And I finish informing to everybody in this webinar that my office, my team, just published a couple of weeks ago a report on the 3 paradoxes that have been kept Africa from delivering development: finance paradox, energy paradox, and food systems paradox. And addressing these 3 paradoxes will be crucial to create the fiscal space so that we can put social protection within national budgets, integrating a more top-down Western model with a bottom-up social protection traditional mechanisms. Thank you very much. Back to you, moderator.
Thank you so much, USD Duarte. I think that was quite enlightening as opening remarks. Really, you have helped us to set the stage. And I think you've even provided a very good framework for macroeconomists to think through around the 6 ideas you've shared. We really thank you very much for your time, but also for really inspiring us as we move in our discussions. USG, for your benefits.
I need to leave. My apologies. Yeah. I need to run to another meeting, another annual conference. And thank you for having me. Thank you, Daniel. The best. Thank you. But I need to leave. Thank you very much.
Thank you so much for your time. Appreciate it. So I would like to recognize Madame Aminata Sow, who is Déléguée Générale à la Protection Sociale et la Solidarité Nationale in Senegal. I also would like to recognize Mr. Serigne Diouf, who is Directeur des Opérations de l'Agence nationale de la couverture maladie universelle, also in Senegal. Let me recognize our director, Jean-Paul Adam. So you are welcome. It's good to have you in this webinar. Thank you for joining. Okay, after those remarks, I would like to call upon our different panelists. I would like to start with Prof. Torkelson, really to share, his first thoughts, especially around the importance of having an urgent expansion of cash transfer in Africa. Prof, are you with us?
I am with you. Thank you very much.
Welcome.
I'd like to start off by saying thank you to you, moderator, to the Special Advisor for Africa, and to all the office staff for hosting this webinar. It is an important issue. And I'd also like to thank my fellow panelists. It's wonderful to be here in conversation with you today. So I've been invited to speak here because I recently co-wrote a policy brief with Melisu Lema, Nathaniel Ojong, and Ibn Owusu Addo on the urgent need for expanded cash transfers in Africa. And it will be published through the Special Advisor's Office next week. And so in it, we deal with the question that I've been assigned today, which is, does the evidence show that cash transfer programs in Africa lead to strengthened resilience, especially amongst the most marginalized segments of the population? And what we found in our work is that the answer is a resounding yes. We wrote this brief about a year ago in the context of COVID-19. And as we all know, what started as a global health crisis quickly catalyzed a global economic crisis. Billions of people around the world already suffering from systemic inequalities lost their livelihoods. Women, children, informally employed people were most affected, suffering a decline in work opportunities and an increased burden of care. But amid this crisis, there was one bright spot: the unprecedented rollout of cash transfer programs around the world, but also across the continent. Ugo Gentilini found that 876 cash transfer programs were introduced to support 1.3 billion people globally, including 10% of Africa's population. Cash transfers are, of course, monthly cash grants paid to targeted populations, usually children, families, elderly, and disabled people. And they work because they provide regular financial support to people who are best positioned to make decisions about their household provisioning needs. So with this massive rollout of cash transfers, there were success stories from around the continent. Stephen Devereaux found that Angola, Ivory Coast, Gambia, Liberia, Nigeria, and Tunisia increased payments to beneficiaries of existing cash transfer schemes for the duration of their lockdowns. Egypt, Lesotho, Kenya, South Sudan, and Rwanda expanded their existing programs to include newly vulnerable households made vulnerable by the pandemic. Burkina Faso, Somalia, Benin, Niger, Mauritania, Morocco, and Sierra Leone launched new cash transfer programs that specifically targeted vulnerable groups. The proliferation under COVID-19 of cash transfer programs serves as important proof of concept. In a very short time, African countries overcame substantial financial, administrative, and infrastructural barriers to deliver support. So to us, the authors of this policy brief, this really demonstrated that expanded social protection can become a reality for Africa in a very short time. And African governments can expand on these successes of cash transfer programs to guarantee a basic level of income security for all. Of course, cash transfers are not new. They predate COVID by decades. We know they emerged in Latin America in the 1980s after the failure of structural adjustment programs and the further impoverishment of populations. In Latin America, they were mostly conditional, and payment was dependent upon recipients fulfilling certain conditions related to work, health, or education. But when cash transfers really took off in the 90s in Africa, most countries chose to implement unconditional programs because they're cheaper, require less bureaucratic oversight, and produce greater results. So my co-author, Nathaniel Ojong, showed that there were already 46 cash transfer programs in Africa prior to COVID. So some of what we can do is actually build on what's already there. Cash transfers have been some of the most rigorously evaluated development programs. Another one of my co-authors, Ibn Awusu Ado, reviewed the major studies of African cash transfer programs and showed that they are good value for money. They do not put a drain on the national fiscus, but actually help stimulate economic activity by encouraging people to either enter formal employment, start small businesses, seek out more training, reduce indebtedness, cope with shocks, and make investments in their future. They also have been shown to improve childhood nutrition, school attendance, and women's empowerment. They decrease poverty, HIV transmission, child labor, and early marriage. Those are just some of the things. These studies have been intense, long-term, and proved that they do a lot. And there has never been any evidence in any single one of these studies that they make people lazy or dependent on the state. In fact, quite the opposite. As the special advisor says, these are a development policy. They are a nationally appropriate economic driver of development. So given the weight of this evidence, I want to make 3 brief points about why we feel cash transfers are well placed to strengthen resilience amongst vulnerable populations. The most significant reason, I think, is that cash transfers are a citizen entitlement. So the most significant cash transfer programs seek to recognize that all people within a country deserve to share in that country's wealth. People have contributed to the nation, even where formal employment is perhaps scarce. People create value through their daily activities, agriculture, entrepreneurship, care work. Cash transfer programs recognize that everybody creates value and everyone deserves a living wage guaranteed by the nation. There are other possible interventions, of course, which we'll hear about on this panel that don't come from the state, but are community driven. And yes, these are important too. But I think they're more complementary and should not just replace government initiatives. These things are powerful together. My co-author, Melasu Lema, has written about how cash transfers should be included in constitutional frameworks and legislation to guarantee social protection and cash transfers for everyone as a citizen's right because they live in that country. Second, cash transfers need strong social protection distribution networks. And that's what really helps cultivate resilience amongst vulnerable populations. These things are good alone, but they're better in combination with other social protection mechanisms. So even though they're good value for money themselves, we can't underestimate the expense of building a vast network for distributing cash. Geographical distance and uneven infrastructure are difficult to overcome cheaply. This is what my research is about. So there's a big push to leapfrog over traditional banking infrastructure and use private technology companies to deliver cash transfers. I've written about how this can exclude people without mobile devices, digital literacy, and internet connectivity. So cash transfers require state intervention in strong, well-regulated infrastructure to get money to people. Things like internet, airtime, data, post offices, payment systems, public transport. And the effectiveness of cash transfers are multiplied by this investment in public infrastructure. School feeding schemes, water, electricity, healthcare actually help because then people don't have to spend their cash transfer on these essentials and can use their grants for economic development. And third, one of the things that we found is that governments can actually pay for them. As the special as we found, and as the special advisor said, though African governments have been increasing their contributions in recent years to cash transfer programs, many are still predominantly donor-driven, which makes the terms and conditions also donor-driven. But African countries can steadily take those back and take those over. We saw this under COVID. So social transfers in post-war Europe amounted to about 20 to 35% of the GDP of respective countries, while cash transfers in Africa right now have been around 5 to 13%. In middle-income countries like South Africa, economists from the Institute for Economic Justice have calculated that raising income taxes on wealthy individuals, instituting taxes on property and luxury goods, and removing corporate tax breaks can curtail excessive accumulation and redistribute money to vulnerable people. In lower income countries, it's of course more tricky, but again, donor-funded programs can gradually be replaced by national government initiatives. So overall, the policy brief that we wrote and will be on the website next week by myself, Lema, Ojong, and Owusu-Addo shows that cash transfer programs are among the best possible strategies that we have to intervene and accelerate development for marginalized people in Africa. Thank you.
Thank you very much, Prof. I think that was insightful, interesting, a lot of facts. Really appreciate your intervention. So we all look forward to really having and reading that policy brief. Let me, without taking much time, move to Mr. Kanute. Sir, are you with us?
Hello, Barasu, can you hear me?
Yes, you have the floor.
Thank you very much.
8 minutes, please.
Okay.
Thank you.
Right. Thank you very much indeed. Let me thank the Undersecretary General, Special Advisor. I mean, her passion is so inspiring and contagious. Et je voudrais donc parler en français en commençant par présenter brièvement SICODEV. C'est l'Institut panafricain pour la citoyenneté, les consommateurs et le développement. Et nous sommes basés à Dakar, au Sénégal. Nos programmes visent tous à faciliter l'accès des citoyens consommateurs et particulièrement les plus défavorisés, notamment une alimentation saine et nutritive produite de manière durable, l'eau, l'assainissement et l'hygiène, la santé, l'énergie durable, les télécommunications. Je voudrais dire merci à Madame la secrétaire générale adjointe de poser un débat qui aujourd'hui est incontournable. C'est la soutenabilité de nos systèmes de protection sociale. SICODEV travaille sur 3 leviers de protection sociale: la santé, les bourses de sécurité familiale et l'alimentation scolaire. Pour les besoins de mon intervention dans ce webinaire, je voudrais focaliser sur l'un des leviers cruciaux de protection sociale, je veux dire l'accès à la santé. Vu la centralité de la santé dans toute politique de développement économique et social, les chefs d'État africains ont adopté en avril 2001 la déclaration d'Abuja d'allouer 15% de leur budget à la santé. Très peu de pays africains ont atteint cet objectif. Le Sénégal en est à 9,5%. En 2012, le nouveau gouvernement a engagé une politique ambitieuse de couverture maladie universelle, car seuls 20% de la population était couverte. Contre le risque maladie, les 80% étaient composés principalement de ménages ruraux et ceux du secteur informel. Alors, pour matérialiser sa vision et sa volonté d'investir dans le capital humain, l'État du Sénégal a établi la Délégation générale à la protection sociale et la solidarité nationale et l'Agence nationale pour la couverture maladie universelle. Je voudrais saluer la présence parmi nous des dirigeants au plus haut niveau de ces deux institutions à cet événement, Madame Sow, déléguée générale à la protection sociale, et M. Diouf, le directeur des opérations de l'agence de la CMI. Merci pour votre présence et participation à cet événement. Deux politiques phares ont accompagné ces innovations institutionnelles qui traduisaient la volonté d'instaurer une politique de protection sociale inclusive et équitable. Un, la couverture maladie universelle, CMU, pour permettre aux citoyens de lever la barrière financière pour accéder à la santé. Et les bourses de sécurité familiale pour les plus indigents dans nos communautés. Pour bénéficier de la politique de CMU, chaque citoyen qui en a les moyens devrait cotiser 3 500 francs CFA, environ 6 $ américains par année, et l'État subventionne avec le même montant pour bénéficier d'un paquet de services de soins sans courir le risque de tomber dans la pauvreté. Les citoyens qui sont identifiés comme étant vraiment indigents bénéficient d'une prise en charge totale de l'État, soit 9 000 francs CFA par année, environ 12-13 $. Quant aux bourses de sécurité familiale, l'État s'engageait à un transfert de 25 000 francs CFA par trimestre aux ménages identifiés comme indigents en 2013. Cela représentait un coût de 7 milliards par trimestre pour quelques 50 000 ménages. Le coût est passé aujourd'hui à 13 milliards de francs CFA par trimestre depuis l'augmentation et du nombre de ménages de 50 000 familles bénéficiaires à 296 000 familles, et l'augmentation aussi du montant de la bourse qui est passé de 25 000 francs CFA à 35 000 francs par trimestre et par ménage. Ces mêmes ménages bénéficiant des bourses de sécurité familiale sont aussi automatiquement reversés dans les mutuelles de santé pour bénéficier des soins de santé avec la prise en charge de l'État à raison, je l'ai dit, de 9 000 francs par membre du ménage. Donc, aux 296 000 ménages, il faut aussi ajouter quelques 64 000 personnes vivant avec un handicap et détentrices de la carte égalité de chance. On le voit bien, le coût est élevé pour l'État. Mais en faisant face à ce coût, l'État est en train de remplir sa mission régalienne de veiller à ce que chaque citoyen puisse satisfaire ses besoins essentiels, se loger, se nourrir et vivre dans la dignité. Et cela répond aussi à une demande sociale. Après les années de politique d'ajustement structurel, où nos États ont été contraints de se retirer du social et de l'investissement dans le capital humain. Aujourd'hui, il nous faut relégitimer la protection sociale. La pertinence sociale, économique de ces politiques n'est point en question. La question qui est soulevée est plutôt celle de la soutenabilité financière de ces politiques, celle de leur pérennisation. Quand on regarde les comptes nationaux de la santé, on perçoit très vite que le financement de la santé par l'État reste stationnaire autour de 24% des dépenses courantes de santé et le budget alloué à la santé est bien en deçà des 15% de l'engagement que nos chefs d'État avaient pris à Abuja en 2001. On constate par ailleurs que les ménages constituent en réalité les premiers financiers de leur santé en payant 48% des dépenses courantes de santé. Vu la structure de nos familles, constituées en moins de 10 personnes, parmi lesquelles seuls 4 travaillent, on arrive à la conclusion que ces 48% des dépenses courantes de santé sont en réalité payés par 4 personnes pour les 10 que compte la famille. C'est beaucoup. C'est cette lecture de la réalité qui a poussé Sikodev à identifier les mécanismes qui permettent d'élargir l'assiette de contribution à la prise en charge des dépenses de santé au-delà des 4 personnes dans le ménage qui payent les 48% pour le reste de la famille. Cela nous a alors poussé à interroger les formes d'organisation auxquelles ont recours les citoyens dans le système traditionnel ou informel pour lever la barrière financière en vue de satisfaire leurs besoins essentiels et notamment l'accès aux soins. C'est ce que nous avons appelé les mécanismes endogènes de financement de la santé, ou MEFS en abrégé. Notre étude a révélé plus de 100 formes d'organisation et je voudrais en présenter 3 dont la faisabilité technique a été éprouvée. Le premier, c'est les champs collectifs. Le premier village à avoir réussi la couverture contre le risque maladie pour tous ses habitants l'a fait avec des champs communautaires pour financer leur adhésion aux mutuelles de santé. C'est le chef de village de Kermamatmbayang, dans le département de Foundiougne, qui a décidé d'octroyer un champ aux habitants du village qui doivent y consacrer une partie de leur temps. Les récoltes vendues ont servi à payer leurs cotisations et adhésions aux mutuelles de santé. Ces habitants et leurs chefs de village estiment ne pas devoir attendre d'être enrôlés dans les programmes de bourse de sécurité familiale pour se soigner. La leçon est que être pauvre ne veut pas dire ne pas être productif. L'Union départementale de l'assurance maladie de Foundiougne, l'UDAM, les a accompagnés avec la collectivité territoriale, avec l'agence de la CMU et la coopération belge pour atteindre ce résultat de couverture universelle. Aujourd'hui, le champ est passé de 1 à 2 hectares et 16 autres chefs de village ont marqué leur intérêt à suivre l'exemple de Kermamatmbayang. On voit tout l'intérêt pour les finances publiques et la pérennisation du système de protection sociale. Le deuxième mécanisme est les cotisations en nature. La pauvreté monétaire est une caractéristique de beaucoup de localités en zone rurale. Même si la volonté de payer les cotisations pour adhérer aux mutuelles de santé est forte, les populations, essentiellement des producteurs, éprouvent des difficultés à lever les moyens financiers en espèces pour le faire. Par contre, ils disent disposer de produits locaux qui viennent de leurs champs et qu'ils seraient prêts à remettre comme leurs frais d'adhésion et de cotisation aux mutuelles de santé. Sikodev, en partenariat avec l'Agence nationale de la CMU et son service régional, ont organisé des ateliers dans 6 arrondissements pour discuter de la faisabilité technique. Ces ateliers ont regroupé les producteurs, les mutualistes, les transformateurs, les autorités administratives locales, les chefs de village et la chambre de commerce. À l'issue de ces ateliers, les populations et les autorités techniques et administratives sont convenues des produits éligibles. La chambre de commerce est engagée à leur trouver des marchés. Les chefs de village se sont engagés à leur octroyer des champs pour élargir leur espace de culture. Les maires ont octroyé des subventions pour faciliter le partage de l'information. Le second village à avoir atteint la couverture maladie universelle au Sénégal s'appelle Noubou et est le fruit de cette initiative dans la région de Kédougou, dans le département de Dakatili. Les sous-préfets des 6 arrondissements pilotes ont pris des arrêtés pour institutionnaliser ces mécanismes endogènes de financement de la santé et mettre en place des outils et des instruments de suivi et d'évaluation. Troisième exemple de mécanisme endogène de financement de la santé, c'est le couplage microcrédit, microassurance. Dans les zones urbaines et surtout périurbaines de la plupart des villes sénégalaises, les femmes vivant de petits commerces dans le secteur informel se regroupent dans des associations villageoises d'épargne et de crédit, en abrégé AVEC, pour répondre à leurs besoins d'autonomisation économique en prenant en charge leurs besoins essentiels. Ces AVEC drainent souvent de fortes sommes d'argent qui malheureusement sont plus orientées vers la consommation, cérémonie, construction, et moins dans l'investissement ou la prévoyance maladie. Les unions départementales d'assurance maladie de Gossas, Founioul, Fatick, en partenariat avec SICODER, ont réussi à sensibiliser les membres de ces AVEC pour inclure le volet micro-assurance dans leur caisse d'épargne et de crédit. Ainsi, en l'espace de 3 ans, 383 caisses ont intégré l'assurance maladie et ont réussi à enrôler 27 605 personnes. Monsieur le modérateur, que nous apprennent et nous recommandent ces expériences de mécanismes endogènes de financement de la santé et de protection sociale? Elles nous apprennent qu'elles réussissent parce que, 1, elles sont ancrées dans la culture locale. 2, les populations s'en approprient et les contrôlent. 3, les autorités et institutions administratives et techniques locales, dont les préfets, l'agent de la CMU, les chefs de village, les collectivités territoriales, les chambres de commerce, tous ceux-là, tous ces acteurs accompagnent et reconnaissent les mécanismes endogènes de financement et les acceptent en les institutionnalisant dans les politiques publiques à côté des systèmes formels déjà existants. Pour ce faire, il nous faut accepter 3 choses. 1, identifier ces formes d'organisation communautaire pour la protection sociale. 2, les promouvoir. Et 3, les institutionnaliser. Merci de votre attention.
Merci beaucoup, M. Kanouté. Je dois avouer que vraiment, c'est un plaisir de vous écouter toujours. Je n'ai pas voulu vraiment vous arrêter, même après les 8 minutes, parce que ce que vous partagez était tellement intéressant et je vous remercie beaucoup d'avoir partagé l'expérience du Sénégal.
Merci beaucoup.
Voilà. Maintenant, je vais passer la parole à Madame Nakazi. Madame, si vous êtes là, je vous donne la parole pour 8 minutes, si c'est possible.
Yes. Thank you, moderator, and thank you, the Undersecretary, for giving us the opening remarks. They are really encouraging into our discussions. Please allow me to turn off my camera for the stability of my internet here. So to start with, I'm called Nakazi Florence. I work for the Economic Policy Research Center as a research fellow. So what do we do as EPRC? EPRC is Uganda's leading policy think tank that deals basically in economic and development policy-oriented research. We've been in this business of policy research for over 30 years. So that is what we do. In line with today's webinar, I'm here to discuss the pathways for Uganda's social protection. As earlier mentioned by the previous speaker, especially the Undersecretary, of course, social protection is not new to Uganda as well. We've seen traditional methods of how people were trying to overcome vulnerability through groups, through pooling resources. But Uganda as a country, basically, they started on the roadmap of establishing a formal social protection in 2015 with the approval of the National Social Protection Policy. So this was more like a green light, much had been done before, but now government, the cabinet is approving that for sure we need the regulatory framework, the guiding principles upon which social protection is supposed to be delivered in Uganda. So once that was set up, when we look at how Uganda delivers on social protection, it uses a two-pronged approach. We have the Social Security Fund and then the social care and the support arm of it. So when we go for social security, basically government delivers this through two avenues. That is the direct income support and the social insurance. So in this direct income support, from the submission is where we see both the cash transfers and the non-cash transfers. Cash transfers that are conditional and some which are not conditional in a way. Then when we go the other arm, when we are delivering social security through social insurance, is basically we see saving schemes that are coming up. People saving formally. Of course, the informal mechanisms are still limited, but again, that shows how far we've moved. So in line with what I was supposed to share as far as the mechanisms are concerned, I'll start with the unconditional cash transfer. This basically started around 2010 when government, of course, formalized the regulatory framework through the National Social Policy of 2015. So under this, we have a program that is called SAGE. SAGE, basically in full, is the Social Assistance Grants for Empowerment. This started around 2010, more like a pilot. Government wanted to test that if we do this, will it work? So that time when it was more, this involves like giving a cash transfer of 25,000 Ugandan shillings to all adults who are 80 years and above. So when it started, like I said, it's more like a pilot in 2010. Then when things materialized after 5 years, because at the time when it was a pilot from 2010 to 2015, it only covered 15 districts. Then later, having evaluated how it had worked to the different vulnerable groups, in 2015, they increased to more districts. So I'm happy to report that from that time, this unconditional cash transfer was formally rolled out to all the districts in 2018. What does it mean? That whoever is 80 years and above qualifies for a monthly pay of 25 Ugandan shillings. But I'll of course share the challenges. Then the other mechanism that government has also used is around the use of public works. Under the public works, of course, here we basically have the NUSA, which is called Northern Uganda Social Action Fund. This basically came in around 2003 for the northern part of the country that had been affected for several years under insecurity. So how does this one work? Of course, here we are giving you cash, but you have to work for it. So what happens is here, a community prioritizes. If we want a road, we say, okay. Of course, there are those who will be given cash when they've not worked because they are unable to work. But for those who are aided, they will go ahead, maybe work on a road. Once that task is accomplished, their money comes in. So this is basically people getting cash, but after they've worked for it. Then the other programs we also see for the food programs, especially in schools, more or less the Karamoja part, because of the drought and the seasonal issues, children are encouraged to be in school, people are given food. So apart from those, as earlier mentioned, the other mechanism to take the social insurance part of it, where we see the National Social Security Fund, and this is basically for those who are employed in the formal sector. What does that mean? That at the end of every month, you remit 15% of your salary, and this 15%, 10% is paid by your employer, and you, the employee, contribute 5%. Initially, before the law was amended on NSSF, you were only supposed to get that saving after you made 65 years. But right now, as I speak, there was an amendment that once you clock 45 years, you can get your money. So apart from that, we also see informal schemes that are coming up, different organizations, banks, trying to pull the employees to save for their retirement. But even then, much as those, we see, of course, this coming up, but there is still a gap as far as the informal sector is concerned. Most of the schemes we are seeing are those at least who can earn something, Of course, we see some informal schemes like the Mazima voluntary schemes where somebody can be able to save however much is little as 2,000 Ugandan shillings per month, so that they can withdraw at that time when they need to use that money. Then the other social care support, as mentioned by the previous speaker, also have some mechanisms here in Uganda. These take basically the child protection, care of the vulnerable groups, and then the violence against violence. But again, of course, these are still limited, partly because the funding, and because most of these are either small projects on a short term that come 2 to 3 years and they are done. So in terms of sustainability, what does that mean? That how shall we survive when we don't have funding? Right now, actually, we're almost grasping that World Bank pulled out on Uganda, so we no longer get funding. But again, this is the time when even they were designing another program called NUSA 4, which was supposed to have started up. I'm told it's in the advanced stages, so we also have those issues. So what do we learn from all this that Uganda has done? So the key lesson that I can say that for sure, sorry, I never wanted to go, okay, let me just take you back to the key successes that some of those mechanisms have been able to enable Uganda to move. So right now, as I mentioned, from a pilot stage of having the senior citizens grant in 2010, right now the government rolled it out in 2018. And in June 2022, government took over its funding. As earlier mentioned from the previous speaker, it means there is a possibility that much as governments are hiding behind that they cannot meet that financing part, as earlier mentioned by the Undersecretary. Uganda in June 2022 officially took over the funding for that stage that covers the elder of 80 years and above. Then the other success that we've seen is over time, when we were hit by COVID, government had to maneuver through either doing food transfers or cash transfers. Initially, when it was just March 2022, they hurried in, brought food, gave to people, but we had issues. Did we have a central registry where we knew this vulnerable person lives, how can we target? So we had our own issues of targeting, and those kind of transfers ended up even not going to the targeted beneficiaries. So when it came to the second lockdown around June 2021, government again switched from food to cash transfer. But the same thing, because we didn't have the structures in place to enable the government target very well, money again ended up in that. So that means when we're hit by this COVID-19 pandemic, we weren't prepared. Government did not have enough structures to enable it target. So over time, we see some of those issues. But despite all those that we are seeing, for sure we are not doing well. When you look at Uganda, of course, the Undersecretary gave us the percentages of social protection for Africa being at 17%. As here in Uganda, only 5% the population is covered by any formal means of social protection. So we are really doing badly. So the key lessons that I can share with you as far as Uganda's case is concerned is we need to use a national registry. This is more like a database that has everybody's characteristics, when you are born, when you are not born, when you die, because just imagine now the age that goes to the 80 years and above. If somebody dies, the national system that we do have is good at capturing the birthdays, but when you die, those records are not there. That means even if you wanted to give out the cash transfer, you could continue remitting, but maybe when the person passed on. Then the other part is also to have a social registry. Uganda right now, of course, we are in the implementation stages where we capture all the information. Like that, if you wanted to look out for cash transfers that go maybe to the disabled ones, whichever category, you have such a database that at one point can enable you to sieve out who you want to reach out to. And then apart from cash transfers, as I mentioned, I think a combination of the two, cash transfers and non-cash, is inevitable in this case. Because as mentioned from the labor-intensive works, if you have people who are working and they can ably work for that money to get the cash, then let them go ahead. And then where government sees that these people are vulnerable, they cannot work, then the cash transfer is very well much welcome. Then another lesson that we learned from Ugandan case is community targeting is very key. Because for the public intensive works, you cannot identify a person who is vulnerable if you are based here like in the central or at office. So it's the community that knows whether we have this person and is he really vulnerable. And through those systems, we can ably target the right beneficiaries to be reached out with a different kind of social protection mechanism that the country could be looking out for. So with those remarks, I'll conclude by saying that, of course, mindset change is very key. In our case, before the national rollout in 2018, government used to think that social protection is more like a consumption good. So we need to change our mind from thinking that when we give out cash transfers, people are only going to eat, but they're able to invest because we've seen effects in terms of being able to access medical care, education, and the like. And then the issue of using, if donors are to give us money, they should use the existing government systems for sustainability. Just in that time when they are not able to fund us, we use the systems that have been developed to further reach out to the targeted vulnerable groups. Thank you very much, moderator.
Merci beaucoup, Madame Nakazi, pour votre présentation et surtout d'avoir partagé l'expérience de l'Ouganda. Là encore, ça montre qu'il y a vraiment beaucoup de choses qui se passent dans nos pays. On a besoin de forums pareils pour vraiment partager nos expériences, mais aussi dire au monde qu'il y a des choses qui se passent en Afrique. Merci beaucoup. Maintenant, je vais passer la parole à Dr. Samson pour son intervention. Si vous pouvez vous limiter à 8-10 minutes maximum, s'il vous plaît.
Great, thank you. And I think my video is disabled. I will try to start my video again. No, it says the host has stopped it. I don't know if you want to enable my video.
Okay. Daniel, can you help with that?
But I will start. I'll check again in a second. I want to take the next 8 minutes to answer the question posed in the concept note. How can inclusive digital technologies strengthen social development? And I want to draw on the 3 waves of social protection that have proven so important for Africa over the past several decades. We heard from Aaron a few minutes ago about the first wave, cash transfer programs like South Africa's Child Support Grant or Zambia's Social Cash Transfer or Kenya's OVC Cash Transfer Program. These were propelled forward by the African Union Ministerial in 2006. But I also want to build on that. When I was speaking with the organizers, they mentioned going beyond cash. And we heard from the Secretary General at the beginning of this session about the importance of development. And the second wave embraces these developmental impacts. But the third wave is on the horizon as climate change creates even more powerful disruptors in our society. And we're going to need social protection more than ever to tackle the enormous vulnerabilities and enable a just transition to nation building, to development, to green and sustainable prosperity. And if I want to point to these 3 waves and identify 4 of the key lessons, the first wave was largely driven by new digital technologies that better enabled governments to extend social assistance programs, cash transfer programs in particular, to poor and vulnerable households. Now, there's a whole lot wrapped in that. I'll talk more about that as we get into the Q&A. But I want to highlight 2 of the key messages that both Florence and Aaron made in their presentations, that these technologies can also be highly exclusionary and can violate people's rights to social protection, but they can also propel adverse inclusion, as Aaron has documented so insightfully in much of her research. These technologies that build financial superhighways from the pockets of the poor to the larger economy. Yes, they can be used for development, but they can be used to exploit the poor and vulnerable with financial mechanisms and debt and other financial mechanisms that can undermine their well-being. But I want to focus a lot on this second wave, because this is where social protection demonstrates its developmental impact by building bridges to other sectors. And we extend that second wave at a strategic level, where social protection can provide the glue that binds together the planks of development frameworks. And an overarching theme in this discussion here is the power of technology to support governments' ever expanding ambition in using social protection more and more developmentally. Now, I just want to take a brief survey through these three waves. The first wave, which started in Latin America and in countries in Africa like Kenya and Zambia and South Africa, really surged in the first part of this century, from only 9 countries with 25 programs at the beginning of the millennium to virtually every country on the continent having a cash transfer program. And people will debate what was driving this. Is it a developmental revolution from the global south, or do donor strategies have undue influence? We can get into that in the debate, but COVID demonstrated how rapidly every country virtually in Africa adopted cash transfers to build resilience. But the challenges of exclusion and adverse inclusion were embedded in the use of digital technologies. And I'm going to talk more about those in just a minute, but I want to turn to the second wave because the Secretary General highlighted this distinction between poverty and development. And while Uganda's SAGE program may be seen as a first wave instrument, a cash transfer program, it also embeds developmental pluses like savings groups and awareness building and other programs within Uganda, like Girls Empowering Girls, nutrition programs across the continent, asset transfer programs, and benefit for asset programs, again, as we heard from the Secretary General. Some of South Africa's more successful expanded public works programs, working for water, working on fire. These are examples of the second wave, which Rwanda has enshrined in a national sustainable graduation strategy. And COVID has demonstrated how vitally important it is to move beyond tackling poverty and integrate, build bridges from social protection to, again, as the Secretary General highlighted, to human capital development. And nutrition is at the core of this developmental strategy. And it involves a complex gearwork of multiple interventions that have to work together in an integrated way. And we see, for example, in Ethiopia, when we apply technology to understanding the relationships among social protection and women's empowerment and health and education, that most of the success in Ethiopia in achieving the Sustainable Development Goals and making progress towards this achievement is not by investing in education to strengthen educational outcomes or by investing in health to achieve health outcomes, but it's in the cross terms, it's in the interaction effects. It's how health extends people's life and increases the rates of return to education. It's how education changes health-seeking behavior. It's how the Women's Bureau in so many Waredas creates a developmental synergy, improving access, particularly for girls, and enables powerful developmental impacts that enable social protection to support the achievement of at least 14 of the 17 Sustainable Development Goals. And the complexity of this synergy building requires new technologies, a repurposing of social registries from excluding the poorest because of the poor design of their targeting methodologies to linking households to the developmental programs that will make the biggest difference. And this brings us to the third wave, which for some countries is still on the horizon, but for many countries have already borne the brunt of climate change, the most enormous disruptor that we will have in our lifetime. And COVID has been a metaphor for that in so many ways. One of them, the vital importance of inclusive digital technologies in helping us cope. How did we all survive the pandemic? This Zoom call is an example of the kind of technology that has changed the way we work. But telehealth, emergency remote learning, e-markets, virtual government services, in every domain, digital technologies are part of the resilience building strategy. But in another important way, COVID is a harbinger of future shocks. In so many African countries, people were so profoundly affected by the pandemic, even before the countries had seen the coronavirus. The policy response to COVID all around the world so accelerated and intensified the social and economic consequences and demonstrated the need for social protection to integrate as the social dimension of integrated climate development and equity strategies. And inclusive digital technologies, investments in human capital, there are a range of initiatives that do double burden in enabling climate change adaptation and mitigation. And around the world, some of the multilateral development banks are on the forefront of this embrace of social protection as the vital glue that binds together the planks of integrated development strategy. And an ongoing theme throughout these three waves have been the gradual and progressive embrace of technology. Cash transfers are simple, just give money to the poor. But the second wave, strengthening developmental impacts, requires a more profound integration. And this will be expanded during the third wave. I was asked to speak to a role for artificial intelligence. And I want to highlight there's been enormous experimentation around the world in using AI to support social protection. Most of this has focused, I think, very unconstructively on targeting and very riskily on caseworker management. The proxy means test is a metaphor for AI. It's not AI, it's just a metaphor. It's an algorithm, but it's often opaque, poorly understood, and highly exclusionary. And those are the risks of adopting artificial intelligence to support targeting. Even the designers of these AI systems often do not understand how they work. Do we want to relegate the most important rights-based mechanism that governments deliver to something people don't understand? Before we turn to artificial intelligence, we should not give up on the capacity of natural intelligence. So much of this investment in artificial intelligence is trying to recreate solutions that some of Africa's best experts have solved long ago. Thandeka Mkandawiri, for example, decades ago identified universal approaches as the right solution to the vexing poverty targeting problem. But AI may help in understanding the dynamics of vulnerability and deprivation and expand our knowledge base and our capacity as long as it's carefully managed by natural intelligence. So I just want to highlight three key waves, three key lessons from these waves. digital technologies can continue to leverage the power of cash transfer programs to expand access, hopefully universally and developmentally, but they must tackle the challenges that Florence just highlighted, that we saw with Uganda's COVID response and all across the continent and around the world, the risk of exclusion. And they must tackle the key problem Aaron identified, adverse inclusion, where technology can actually be a tool that makes the most vulnerable worse off. Rather, we want to use technology to strengthen the developmental linkages, repurposing social registries from tools of targeting to tools of bridge building, and identifying the communities and areas that need to be prioritized for the most relevant developmental interventions, and enable inclusive digital technologies to strengthen the glue that binds the planks together of integrated climate development and equity strategies, and support the just transition to green, inclusive, and sustainable economies and societies. Thank you.
Thank you very much, Doc. I think that was a very good presentation. Most of the participants are actually requesting for the presentation. This will be shared, of course. Thank you again
yes, of course.
For sharing your perspective, but also the two waves. We have 40 minutes left. There are quite a number of questions in the chat. And I also would like to, have some follow-up questions quickly. So to each of the panelists, if you could just in 2 minutes, share your perspective in the follow-up questions so that we give the floor to actually pose and respond to their questions. I'll start with Prof. Are you with us?
I am with you. Sorry, what would you like us to do for our 2 minutes?
For 2 minutes, for you to respond to this question. How do government demonstrate that the initiative around cash transfer system actually contribute to enhancing reliance? So basically what I'm saying is, the intervention from the government, do we have evidence or some, result around the impact that they are delivering, especially for the most vulnerable? Just quickly.
Thank you. Yes, there's extensive evidence. These programs are not new. And as Michael said, they've actually gone through 3 waves. So we have seen both the initial wave of cash transfers associated with other social programs and how that works out together. And now there's lots of talk about what to do with cash transfers in light of climate change. So I would just add that, the evidence is there. If you look at our policy brief or the extensive work that the ILO has done, that all of these things strengthen developmental outcomes, they strengthen economies, they strengthen health outcomes, they strengthen education. The studies on this are so widespread, there's almost no area that has not been looked at. But that also doesn't mean it is exactly appropriate in exactly the same way for every country. So I noticed that in the question and answer box, people had a lot of questions about in-kind transfers versus vouchers versus cash. And sometimes things are more appropriate at one time than others. But when you start to design, as we heard from Florence in the Uganda experience, social protection framework, you can start to kind of move between those things at different times and in different crises, depending on what is most necessary. So I would just say the evidence is there. we can share it after this. It's lots of it is cited in the policy brief that will be published next week. They do help. They are a very good intervention, and there's something that can be done relatively quickly and easily.
Good, good. No, thank you for that. Mr. Kanute, if you are around, I also in 1 or 2 minutes, of course, you've shared the case of Senegal, very interesting. And here, I would like really for you to probably suggest 1 or 2 strategies that African countries can employ to integrate the traditional mechanism into their national social protection strategies.
Yeah. Thanks very much, Mr. Barasu, Dr. Barasu. The very first thing is that our countries need to ensure that they can recognize the traditional systems and work to make sure that they are institutionalized in policymaking. Otherwise, what we have is a dual economy, one formal and the other one which is said to be informal, but which actually is the real economy. These women who are in those forms of self-help groups where they manage to meet their basic needs from mobilizing so much resources, it's such a pity that those resources do not filter into the formal quote-unquote economy. So our governments, when putting up public policies, need to ensure that they, one, identify these forms of organizations, social organizations that exist and that seem to be pulling together a lot of resources. Two, once they have identified these forms of organization, they need to promote them. They need to ensure that they become visible. And three, come up with policies that integrate these forms of economy, this form of quote-unquote informal economy. This is where I believe it is important that we blend these two systems. Otherwise, we will be working with the dual economy, which in the end, I'm not sure will allow the formal system to be sustainable, but will also stifle the informal systems that actually are at the roots of the life of the people. Back to you, Dr. Barasu.
Well, thank you so much, Mr. Kanute, for that. Okay, Dr. Sampson, you just finished your presentation about the waves, but I wanted you, if in 1 minute you could come again on these issues around the potential of digital technology and AI. You mentioned it, and I think it's something that is coming again, and it's very important. It's taking a lot of ground. We don't understand a lot on what is happening around it. Do you think it is possible to use it to enhance the reliance of individuals who are benefiting from the social protection initiatives? So I just want you to focus on that a little bit.
Sure. And I want to distinguish between inclusive digital technologies and artificial intelligence. Inclusive digital technologies have helped governments make cash transfers, enable markets and governments to work better for the poor and vulnerable. These inclusive digital technologies have expanded opportunities and capabilities, and they've provided highly visible benefits that strengthen people's appreciation of what government is doing, and by doing so, reinforce the demand for good governance. artificial intelligence is not very inclusive. As the recent episode in the United States with ChatGPT demonstrates, that decisions are being made very opaquely about the future of artificial intelligence. And there are serious risks to powering client services in social protection through AI. When there's a term for it, hallucination, AI just makes things up. And that's not the kind of tool that's ready for prime time in the social protection sector. But I do believe these tools are game changers in the way people do research and build knowledge, as long as they are carefully managed by natural intelligence. They can expand capabilities for understanding complexity. And that is the key to transitioning from tackling poverty to promoting development. Building bridges across sectors is a very complex undertaking, and AI maybe can help. And certainly as we look to the future, managing a transition to green and sustainable development requires backcasting future scenarios to identify social protection investments necessary today to prepare our future labor force for the challenges, not just of climate change, but the new industries and technologies necessary to manage this transition. There, I am confident AI can eventually probably help, but not without great risk in the meantime.
Absolutely. I think that's important, that precision. Let me get just to Miss Nakazi. Are you with us?
Yes.
Yeah, if you will, of course, you use the case of Uganda, just quickly in 1 or 2 minutes. If you could share probably 1 or 2 notable instances of successful approaches for expanding social protection, considering especially that replicating program in different contexts can be very challenging. So you've succeeded in Uganda. For some, have you had the experience, to learn from other countries or collaborate with other countries that were actually ready or happy to learn from you, or vice versa?
Okay. Thank you very much, moderator. Of course, one of the key lessons that can be replicated is, as mentioned by the previous speakers, we need a combination of both cash transfers and non-cash transfers. Because without those, of course, there's a particular group that will be liable for the cash transfers, and there are those, and as mentioned by Eric, it is hard to only have one. Otherwise, you need a combination of the two to be able to achieve the targeting and the like. And another lesson, of course, this comes in more like in the ICT. Of course, Mike used artificial intelligence, but in line with almost what we are seeing here in Uganda, during that time when we were hit by a pandemic, we didn't have the technology kind of part to have a streamlined kind of database for clear targeting. That means for any country that is planning to reach out to the poorest of the poor or the most vulnerable, they need streamlined systems as far as having streamlined databases that they can really target the right person. So right now, as we move into technological and plan for the future, we need all those systems in place so that even if you wanted out to know who is clicking 80 to be paid, the system can really tell you instead of you going down, look for that person. Because imagine during COVID-19, that time when the elder here were supposed to get their monies at the end of the month, it was hard. You could not reach those communities. So it is time also to embrace technologies. And then the last one is around the financing part. The financing is very key. Of course, from our side, more efforts have been more on the formal part so that we have over the 5%. But now the informal part is very critical. Why? One of the mechanisms we could look at is voluntary contribution. I'm taking an example of like agriculture here, where we know most of the people employed in agriculture. If we are able to convince people that while you are practicing agriculture, you're able to produce and sell, can they use a small proportion of what they sell to save for their old age? Because this serves in two ways. If somebody is able to save from what they are selling, they will be saving for themselves for that time when they need the resources. But even on the government, there is an endowment fund that government can borrow to also finance social protection. Over to you, moderator. Thank you.
Thank you. Thank you very much, Florence, for that response and the strategies, the proposal made. We have 20 minutes to go. There are quite a number of questions. In the chat, let me recognize Colin for his question. Ayi, Nihal, Sefard, Dauda, Kavim, Umaru, Austin, for your questions. So we'll just push them to our speakers for them really to provide quick answer to some of them. Hope we'll be able to cover all of them. From IE, the question is, what is the challenge of inflation for cash transfer program and how to address it? We have also a question from Nihal. He's saying what is the best condition to define the deservers of cash transfer? And from Shefat, is fiscal constraint is usually cited in Africa as the main hindrance to the provision of comprehensive social protection and cash transfer. The question is, what are some of the key policy considerations that African countries can take to improve fiscal space to provide sustainable funding for social protection? So let me start from Mr. Kanute. If you would like to provide just a general answer to or a specific question, just for 2 minutes, and then we'll move to Prof, then to Samson, and then to Florence.
Doctor, I might want to give the opportunity to my colleagues, as most of these questions seem to be either technical or heavily economic.
Yeah, sure. Sure. Prof, would you like to come?
Sure.
Any of those questions?
I'll answer questions on the deservedness and fiscal constraints. So deservedness is obviously a big issue. How to assess that, the systems that one needs to build to assess that. Personally, as much as possible, I'm in agreement that the move toward universal systems gets rid of a lot of the difficulty around assessing poverty, assessing who deserves and who does not deserve a grant. However, a lot of countries do start with programs that are more targeted on children or the elderly or disabled people. And if that's the place that one needs to start from, we have to recognize that that's a good starting place too. So I would just say that within those systems, they need to be broad enough to not exclude people. For instance, under South Africa's COVID expansion, we introduced a whole new grant for people between 18 and 59 who had no income. And for that, very quickly, a proxy means test was devised, which put together all of the different government databases. So the Home Affairs database with population statistics, the tax database from the South African Revenue Service, the database that was held by the South African Social Security Agency, databases from the all of the other social protection programs as well, the public works program, the tertiary education bursary program. And through that, people applied digitally, and then their data was assessed against all of these other databases, and they were rejected if they appeared in any of those other databases. And this led to a very high rate of rejection because since the market contracted massively under COVID-19, lots of people may have had work in the year prior and paid taxes, but they certainly weren't working then. So these systems often are more trouble than actually they're worth and exclude far more people who are actually deserving of those grants. So the best way, if possible, is to universalize, and then after that, to make sure you build systems that are accessible to people, that aren't faceless, like this digital system that South Africa built. There was no way to contest it, no way to provide other evidence, but actually do serve people. And then on the fiscal constraints question, I just want to pick up one thing. I think one of the most interesting analyses that have been produced recently by Olufemi O. Taiwo tries to link this context of climate change with efforts like cash transfers or universal basic income. And he says, amid the fact that African countries in particular are going to suffer some of the greatest shocks from climate change, and amid the fact that African countries were not the biggest producers of carbon emissions and the drivers of climate change, we need to think about the global north providing reparations to the global south for climate. And that could be in the form of things like universal basic income programs or cash transfer programs. So I think we need to think about social protection not only at a national level, but potentially at a global level, and specifically in relation to the global context that Africa is facing going forward. CARICOM from the Caribbean and the AU just agreed to work together on reparations. And I believe that that's vital, particularly more and more as we experience the effects of climate change.
Good. No, thanks, Prof. Doc, do you want to come in for any of those questions?
Sure, I'll just briefly weigh in. Inflation does two things. It erodes the purchasing power of the most vulnerable. They often are the biggest losers from inflation. And they're also eroding the effectiveness of existing grants. They undermine purchasing power. So in the face of inflation, indexing benefit values, enabling them to grow with inflation and protect real purchasing power is vitally important. But also because inflation is a universal shock, it strengthens the case for more universal social protection. I fully appreciate the comments and questions about, well, can we practically deliver universally? But today in Africa, the choice is divided between two very different approaches. One you might call heavy targeting, things like proxy means tests that try to identify every seriously poor person in a country. And that across the continent has been an exercise in failure. I will be happy to expand on the numerous studies that have documented the extraordinarily high, particularly exclusion error rates from proxy means testing and every other form of heavy targeting. But the alternative that so many countries are now adopting, we could call it light targeting. It interacts geographic and demographic targeting, going to the poorest communities and delivering to every family with a child under 5, or to every older person. So you can repurpose these social registries that are instruments of exclusion when used for heavy targeting to identify the vulnerabilities to prioritize. And the advantage of light targeting, it enables programs that cost the exact same amount as heavily targeted programs, but they scale up progressively to universal approaches. And that approach also helps solve the third question. Universal programs, light targeting programs contribute better to developmental outcomes. They're more likely to improve economic growth, which unleashes that fiscal constraint and enables governments to pay more. But I also want to highlight the point Erin made earlier about climate finance. Climate finance is today the only growing area of development finance, drawing the links between social protection and climate response is vital to sustaining and expanding resources. And a final point, more universal approaches, these lighter targeting approaches, are better at nation building. They're better at building smarter economies. They're better at sustaining the political will for financing these programs. As Amartya Sen said, programs for the poor become poor programs. Universal programs ally the middle class with the most vulnerable groups and generate the political will to better resource these programs. Thank you.
Thank you very much. So let me share again a few questions, then we can start with Florence. Okay, this question is about from Austin, who is asking the best approach or mechanism for farm workers who have very low earning, limited only to wages. So I guess Kanute shared the case of Senegal with the farmers, and Umaru is also asking the question, what do you think about the social registry? I think Florence actually alluded to this in her intervention for the case of Uganda. And of course, there was the question around whether cash or non-cash transfer each require robust targeting, as universality may not be the solution to a large populous group. So they're really asking how to really deal with that challenge. So also there were two questions around the use of technology. I guess, Doc, you can come back on those. This one is from Daba Shefareu, who said that the use of technology could help and improve targeting efficiency. However, for humanitarian cash transfer, inclusive digital registration, biometric data are challenging in reaching beneficiaries. How to tackle that? And the other question around technology is just for you to share some of the inclusive digital technology. This is a question from Shepherd. So let me stop there for those questions. We can start with you, Florence, for 2 minutes or so.
Thank you very much. If I may answer the question from Austin about the best approaches for farmers who earn low wages in Zimbabwe. If I may pick few examples from other countries, I think the best approach would be voluntary contributions. We've seen that work in Uganda here. There are voluntary kind of schemes where a person registers, and based on how much you earn, you can contribute on a monthly basis. Such that, of course, there are terms and conditions. You know for how long you want to save, and if you are saving for which period of time. That means the conditions have to be streamlined. So the best approach for such farmers who earn low wages is basically the voluntary contribution, because if you looked at the formal kind of arrangements, sometimes they leave out those low wages because maybe there is a threshold. Yet, if it is voluntary, somebody can know however much I earn a low wage, I can get this out of my saving and put it in that voluntary scheme. Then there was a question from Umar on, I don't know that I got it right, on the effectiveness of social registries. Evidence from other countries that have been able to read on shows that for those countries that for sure had those social registries in place, that time when we had the pandemic, they didn't have issues of targeting. Yet for countries that didn't have, because with those registries, you have a database of everyone with a different variable of interest. If you're looking for the old person, you know that by this time Florence has either reached this age. If you're looking, so the fact that is the only challenge is if they are to work very well, they also need to be updated. Just look at a case where it was put up and information is not updated. That means in targeting, you end up targeting the wrong person. Otherwise, evidence shows that if you have them in place and they have the updated information, for sure, you look out for the right vulnerable person that you are looking out, given the variables. Assuming you want it now like Uganda for stage where they want the 8 and above, of course, through the system, you know that this year, we've had so many who have made 8 years. By this time, if it has also a death column that somebody has passed on, will know that there's so many elder people passed on. So I think they've been an effective way because using the ICT technologies right now, it is hard to go out to hunt for people in the communities. Yet with this, if they are well streamlined, well updated, everything will be online, which will make targeting very easy and also reaching out to the right vulnerable person that the program will be looking out for. Thank you, moderator.
Thank you, Florence. Doc, do you want to come in just for 1 minute, probably around? I'm sure you've responded somehow to those questions.
Sure. I can recap on the technology questions. Yes, there's a lot of enthusiasm to use artificial intelligence and other technologies to improve targeting. The evidence on the effectiveness is still missing. We have no robust evidence that AI can solve the problem that decades of social protection practitioners have stayed awake until 3 a.m. worrying about. The only solution we know to the most vexing problem came from Thandeka Mkandawire. And yes, we appreciate that these universal approaches are fiscally challenging, but the light targeting approach that combines geographic and demographic targeting solves this fiscal constraint. It enables the repurposing of social registries, which governments across Africa have invested so heavily in and are reluctant to not take advantage of this very powerful technological hammer that makes targeting look like a bunch of nails. It enables these governments to repurpose these social registries to progressively scale up more universal approaches in a highly affordable way by identifying the demographic and geographic combinations of extreme vulnerability and progressively scale up this program. Technology is important, but as long as millions of households are disconnected from the internet, and excess reliance on technology will exclude the most vulnerable. Cash transfers were the first viral app that swept across Africa, enthusing policymakers. Information in welfare improving information transfers may be the next viral app for social protection. Social protection's responsibility is to ensure everyone has access to this information and internet digital technology.
Thank you, Doc. Thank you very much. So let me just take a last question. This is for Mr. Kanute. This from Amy Khan, who is asking that given the lack of trust in the system, do you think players in the informal sector would endorse the formalization of the informal sector? Sheikh Kanute, what are your thoughts?
Right. Yes, very tricky one.
Yeah.
But I believe I do not see anybody whom you would tell, look, we are giving you an opportunity to build on your system, on the way you are organized, to ensure that when your child gets sick, you are able to go to hospital and have access to quality health care. I don't think there's anybody, whether you are in the formal or the informal sector, who would not accept that. The problem is to make sure that when you tell people that this service is available and you have to pay a certain amount of money and the government will pay a certain amount of money for you to be able to access this healthcare, when they get to the health structure, they need to find the service is available. Otherwise, there's a break of trust and nobody will believe in you in the future. And that's why we need to ensure that we build on what people are working on. We build on what people control and not impose them anything that might not be part of something that they do not understand. That's what makes the difference between what I have seen with the three examples is because it's controlled by the people, it's part of their culture, they know it, and they have an understanding from the public policy makers. Thank you, Baras.
Thank you very much, Mr. Kanute. I think at this juncture, I would like to invite Madame Aminata Sow, who is Déléguée Générale à la Protection Sociale et la Solidarité Nationale in Senegal, for 2 minutes. She's been working in this area and, we thought it's important really just to get her thought in 2 minutes. Madame, vous avez la parole.
Merci beaucoup, merci de m'avoir invité. Je remercie M. Amadou Kanouté qui m'a donné l'information et je le félicite aussi pour sa contribution qui est très pertinente, très claire. Également pour son implication directe dans, en tout cas, la mise en place d'un système de protection sociale résilient au Sénégal. Au Sénégal, la protection sociale est érigée en rang de priorité. On a beaucoup fait en matière de protection sociale depuis 2012. Mais pour aller vite, les deux problèmes que nous rencontrons, c'est le financement et le ciblage. Pour le financement, M. Kanouté a donné des solutions, quelques pistes de solutions que nous sommes en train d'exploiter, mais il faut davantage l'implication des collectivités territoriales. Puisque c'est la communauté, ce sont les individus, les populations qui sont ciblées, il faut obligatoirement l'implication des communautés, des collectivités territoriales et ce que nous sommes en train de faire. Maintenant, par rapport aussi, en parlant de problèmes de financement, on parle également de problèmes de ciblage et les deux sont liés parce que si on a un bon ciblage, un ciblage qui est transparent, qui est exhaustif, qui est juste, ça nous permet de rationaliser les ressources. Mais pour avoir un ciblage aussi qui puisse permettre de rationaliser les ressources, il faut intégrer la technologie qui va nous permettre de faire des mises à jour continues, qui va nous permettre aussi de rationaliser nos interventions, voir comment arriver à faire un tir groupé sur une cible pour permettre à cette cible d'être plus résiliente, pour permettre à cette cible de sortir de la pauvreté. Ici au Sénégal, nous avons un registre national unique que nous avons mis en place avant la COVID-19. Et avec la COVID-19, nous nous sommes rendus compte qu'il faut étendre ce registre. Et là, nous sommes dans le processus d'extension de notre registre pour le faire passer de 540 000 ménages à 1 million de ménages, c'est-à-dire aller au-delà des populations qui sont pauvres, aller vers les populations qui sont vulnérables, compte tenu de la récurrence des chocs. Donc, par rapport à ça, ce sont les communautés qui sont impliquées parce que ce sont les communautés qui se connaissent entre elles. C'est un ciblage communautaire qui est fait avant l'enquête qui vient après pour le scoring des différents ménages. Hier, je pense que j'ai fait 2 minutes. Hier, nous avons partagé avec notre bureau de suivi opérationnel de notre plan Sénégal émergent, qui est notre document de référence de toutes les politiques publiques que le gouvernement met en œuvre. Et il y a une nouvelle étude qui montre que le ciblage des ménages vulnérables doit prendre en compte l'indice, en tout cas, économique. C'est important, l'indice d'orientation économique. Et c'est une nouvelle étude qui est là, qui va nous permettre de renforcer, de rendre beaucoup plus fiable notre registre national. En résumé, je dirais que nous avons la volonté d'étendre la protection sociale et il le faut, c'est obligatoire parce que la récurrence des systèmes, la récurrence des chocs l'a montré, mais nous avons deux défis. C'est le défi du financement et c'est le défi du ciblage, d'un bon ciblage. Merci beaucoup de m'avoir donné la parole.
Merci beaucoup, Madame Aminata Sow, pour cette intervention. Surtout d'avoir partagé l'expérience du Sénégal qui constitue vraiment un rajout important à la présentation de M. Kanouté. Merci pour votre disponibilité et votre intervention. At this stage, I would like to really thank my panelists. We have 5 minutes. I will allocate those 5 minutes to and invite Daniel Malin, from my colleague from UN OSA, to give the closing remark, but also tell us the next step. I would like really to thank all our panelists for the great ideas, experience shared. You will agree with me that these were the best really panel we could put really for such a topic. We really did not make a mistake bringing them here. They've shared really interesting facts, but also provided concrete examples, case studies, but also good practices. I would like to thank you for your time, my panelists, and hand over to Daniel. Daniel, you have the floor. Merci beaucoup.
Merci beaucoup. Merci beaucoup aussi, Bahasu. And indeed, I mean, right away, I would like to thank you, Barasu, for keeping to time. This is very helpful as we try to keep it within 2 hours. Again, thank you, Barasu. And indeed, much appreciation goes to our 4 panelists today, Professor Torkelson, Mr. Kanouté, Ms. Nakazi, and Dr. Sampson. I would also like to thank Undersecretary General Cristina Duarte for her opening remarks today, as well as our intervention that we just heard from Madame Sow of the government of Senegal. Today, this morning, this afternoon, we have heard rich discussions that have addressed different perspectives and good practices, as well as challenges on attaining sustainable social protection systems in African countries that will ensure the inclusive development needed to help countries on the continent achieve the Sustainable Development Goals and the African Union's Agenda 2063. Although we've heard a very, very rich discussion today, I will not attempt to be exhaustive, but I think indeed, as Barasu mentioned, we've heard diverse perspectives. We've heard examples, we've heard case studies, we've heard of different examples from around the continent. And a message that came out, I think it came out early in today's webinar, is that, frankly, Africa is not poor. This is a message that our Undersecretary General Duarte often mentions, that Africa is not poor. There are many mechanisms in the area of social protection, if we look at social protection, that demonstrate that the continent has the ability, mechanisms in place, traditional cash transfers that can ensure fully sustainable development owned by Africa, owned by African countries. A message that came forward clearly was the need to manage development, not to manage poverty, is something that came out early in our discussions. We've heard about different mechanisms that have been prevalent over the decades, over recent decades, cash transfers, more traditional mechanisms we've heard about from Senegal, very, very interesting examples of the agricultural field system in which earnings go towards ensuring healthcare for citizens around Senegal. I think the key that comes out of this webinar is the sharing of experiences and best practices, challenges that have come from various countries. So again, I will not look to be exhaustive. We've heard many interesting ideas and very interesting questions from the audience, but just to inform that a report of today's webinar is being produced by the Office of the Special Advisor on Africa, and we will look to have that published as soon as possible. You will find that on the website of OSA, which is un.org/OSAA. I would like to thank Barasu and the entire African Capacity Building Foundation for the continued partnership. Although OSA is located here in New York at UN headquarters, we're glad to have ACBF as a partner that is on the ground and very much in touch with the economic and social issues affecting the continent. Before closing, I would also like to acknowledge and thank OSA colleagues, Ms. Ray Zhu and Mr. David Wright, who I work with and who have done and continue to carry out research and collaboration on this very important topic of social protection issues in Africa. Finally, if members of today's audience would like to continue today's conversation on social protection with our experts, with ACBF, with OSA, please feel free to send me an email at daniel.mallon@un.org. I think I put that in the chat. Also, I see that Dr. Sampson has put his email address in the chat, because today's webinar is not the end, although it was very rich during its 2 hours, but it is the beginning for a continued discussion on social protection mechanisms and ideas for going forward in Africa. On that note, as we reach 11 o'clock here in New York, I would like to thank the audience today and today's speakers for their participation, and I declare the webinar closed. Thank you very much.
Thank you.
Thank you, Barasu. Have a good day, everyone, or a good rest of your day.
Thank you. Take care.